Human Physiology. Today's topic is leukocytosis. What is leukocytosis? Normal leukocyte count is 4 to 11,000 per cubic millimeter of blood. If it is more than 11,000 per cubic millimeter of blood, then the condition is known as leukocytosis. Leukocytosis 11,000 more than 11,000. Then it is leukocytosis. It may be 12,000, 13,000, 15, etc. Then it is leukocytosis. What are the causes? Physiological cause. In newborns, in infants, normally WBC count is more, 18,000 to 20,000 per cubic millimeter of blood. It is in normal infants. Then after physical exercise, in pregnancy, after parturition, extreme temperature, extreme exposure to extreme temperature, very high or very low. Then pathological infection, acute or chronic infection, acute infection, pyogenic infection or any type of infection, for example, boils, sore throat, appendicitis, septicemia, pneumonia, meningitis, peritonitis, hepatitis, and in chronic, for example, tuberculosis. Then inflammation in the body, inflammation at any site of the body, for example, hepatitis, peritonitis. Peritonitis means inflammation of the peritoneum, meningitis, inflammation of meninges, and hepatitis, liver, inflammation in liver due to any cause. It may be amoebic hepatitis, it may be viral hepatitis, anything. Then inflammation in body, any side. Then after myocardial infarction, WBC is raised. Allergic conditions, for example, bronchial asthma, hay fever, or contact dermatitis. Acute hemorrhage after acute bleeding, post-operative, burns, some drugs, and malignancies. In malignancy, this WBC count is raised. These are the causes of leukocytosis, physiological and pathological. Okay. Now differential diagnosis. Differential diagnosis with Leukmoid reaction. First is this Leukmoid reaction. Leukmoid reaction means WBC count is more. It is in 40 to 50,000 per cubic millimeter of blood, and there are mature cells as well as some immature cells are also present, but their function is normal function, and leukocyte alkaline phosphatase is raised. Leukmoid reaction. Okay, it is clear. It is seen in chronic infection. Leukmoid reaction is seen in chronic infection. Number 2, in carcinoma of lung, kidney, lungs, kidney, ovary, breast or prostate. It is normal, count is raised. It is in range of 40 to 50,000 per cubic millimeter of blood. But to differentiate it from leukemia, this leukocyte alkaline phosphatase is raised. In case of leukemia, alkaline phosphatase, leukocyte alkaline phosphatase is reduced. This is chronic. Number 3 is leukemia. Leukemia is carcinoma, malignant stage of leukemia is malignant condition of the blood. It is also known as blood cancer. In this case, there are increased number of WBC in, it may be up to 1 lakh or above per cubic millimeter of blood, and differential diagnosis, it is leukocyte alkaline phosphatase is reduced. Number 1. Number 2, immature cells are present and they are functionally immature. They are of no use. This is leukemia. It is known as blood cancer or malignancy. It is of mainly 2 types, myeloid and lymphoid carcinoma. Okay, this is leukemia. Third is leukoerythroblastic reaction. Leukoerythroblastic reaction is characterized by lymphoid type of reaction, that is, it is WBC is 50,000, 40 to 50,000 per cubic millimeter of blood associated with erythrocytes, progeners of erythrocytes. It may be early normoblast, late intermediate normoblast, and late normoblast. This is known as leukoerythroblastic reaction, the form of carcinoma. Okay. Now, differential diagnosis, sign and symptom. Sign and symptom depends upon the underlying condition. Leukocytosis is not a disease, it is a manifestation, and sign and symptom depends upon the cause, etiological cause. For example, in boil, sore throat, etc., there may be fever, appendicitis, pain in right iliac fossa, in septicemia, pneumonia, meningitis. In all these cases, the symptoms or signs will depend upon the underlying cause, underlying disease. But weakness, lethargy, drowsiness, etc. are common, non-specific. Weakness, lethargy, etc. are common. Then differential diagnosis. How we will diagnose it? Diagnosis is by complete blood count, CBC. Complete blood count will show the number of this leukocyte and number of other types of WBC, that is neutrophil, eosinophil, basophil, monocyte, and lymphocyte. CBC or peripheral blood smear. Peripheral blood smear will also show, and bone marrow examination. Bone marrow tapping or bone marrow smear is taken, and this is examined to know the cause of CBC. If all these common things are not, it will prove or disprove. It will confirm the diagnosis of this leukocytosis, whether it is carcinomatous, whether it is benign or malignant type. Okay, this is about leukocytosis. This video is for awareness. It is not a medical advice, and in case of medical advice, take advice of your medical care providers. Thank you for watching. Please like this video, share it, and subscribe the channel. Thank you very much.